I'm Tori Landau. I live in Northern Ireland and I have systemic lupus erythematosus. "14 years ago, I joined Second Life and I enjoy being a DJ, building things, volunteering, and being able to do activities that I am unable to do in real life. Computer-based learning educator, musician, and I've been a carer to several family members. Today, I'd like to introduce Lillie Greiman, who is the Project Director of the Research and Training Center on Disability in Rural Communities at the University of Montana. Lillie has been with the Centre since 2012, working to improve the lives of people with disabilities in rural communities. Lillie's presentation today is Disability Data for Advocacy and Awareness. The presentation will showcase how the data-focused tools RTC Rural has developed have been used by their partners and also the work that RTC Rural does to support disabled advocates, researchers and consumers. Please remember to wait until the end before typing comments and questions, otherwise it will interrupt Lillie's talk. Welcome, Lillie. The floor is yours.
Thank you. All right. Hello, everyone. Can you see me and my slides? And hear me?
And hear you all is clear.
Okay. And my audio sounds good. I don't know if if it's too loud or... All right. Wonderful. Well, thank you so much, Tori, and thanks everyone for attending and being here. I feel privileged to have this opportunity. It's been my first experience in Second Life, and I am enjoying it quite a bit. All right, well, yeah, I think that I will just get started. So as Tori mentioned, my presentation today is called Disability Data for Advocacy and Awareness. My name is Lillie Greiman. This presentation was a collaborative effort, the result of a variety of projects with some colleagues, Ari Lizo and Aaron Leopold, so I want to acknowledge them. And also note that oh, here, I'm using my teleprompter now. That this work was funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, and the views expressed here do not necessarily reflect those of the U.S. federal government. So as I mentioned, my name is Lillie Greiman. I am a project director at the Research and Training Center on Disability in Rural Communities, and also a data nerd, which was not actually something I knew I was until I started this job, but have discovered a love of digging into and visualizing all kinds of data to tell stories and engage with community partners. In this presentation, I hope that we'll spend some time, learning about what the different type of data tools that we have available at the RTC Rural. Also learn about some ongoing disability data advocacy efforts, and explore how folks in the audience can get involved. I'll try to maybe, I don't know if my links will be in the chat later, but I'll have contact information at the end, so anyone who's interested in digging into any of these tools more can reach out. So why does data matter, right? So data matters because really there is power in data. Often data decides who gets represented and how. This is really obvious. This in the United States is really clear around how we get political representation. And it also really matters because the power that is in data, it determines what questions get asked and why. And data systems can be used to marginalize and exclude as much as they can be used to include and understand. So, for example, right, there's good data, bad data, no data. These ideas of inclusion and representation really matter when we're talking about data, particularly when we live in a world that values data very heavily in order to make decisions about really potentially life-changing decisions at the policy level. If there is no data collected for certain populations, or if the questions that are used to determine and gather that data are inappropriate, we have whole swaths of communities that are left out of decision-making processes. And so that is really, really important. And we'll talk a little bit more later about how a group is forming to start addressing and identifying what are those data gaps. Oh yeah, so the ability, again, about focusing on why data matters, the ability to access, understand, and use data is critical to supporting the public health needs of any community. A lot of this has become incredibly apparent over the last few years of the COVID-19 pandemic, and in either failures or successes in collecting data about how the pandemic was impacting different groups. And the result of often missing data is that disabled people are often made invisible across federal policy through the lack of data collection and the lack of representation, which has ultimately resulted in a disability data inequity. And where for me and some partners, where we really noticed and began coalescing around was the lack of data and understanding in COVID-19 on how the pandemic was impacting disabled individuals in congregate settings. And then also, I think there was a lot of conversation around how the disparate impacts of COVID for individuals who kind of live at the intersection of multiple identities, including race and disability and mental health. And I think it's really important, I want to emphasize when I'm talking about congregate settings, it's maybe kind of a jargony term. Really, congregate settings are all facilities where individuals live together and often have limited choice over their daily activities. So it includes places like nursing homes, licensed and unlicensed group homes, detention facilities, prisons, jails, detention centers, and other carceral facilities. And I have a long list here in the chat of different types of congregate settings that exist throughout the U.S., but also across the world. And it's important to understand as well that people with disabilities across all of these settings are disproportionately represented. So there are more people with disabilities living in congregate settings than there are relative to the kind of non-institutional population. So one thing that has been a barrier is that many federal and state data systems require a base technical expertise or even specialized software in order to analyze and access data. And this is a problem, as many, sorry, I'm kind of moving along in the teleprompter here. This is a problem because that data then essentially becomes inaccessible to many of the individuals and advocates who would benefit from understanding and using that data to advocate for change. And so we have been at the Research and Training Center on Disability in rural communities, been working to improve data accessibility and usability across several projects with a range of community partners. And so I'm going to talk a little bit about those tools and right now and highlight some of them just to show that we're trying to bring disability data, specifically data that's available in the US at the county level, to more individuals in more accessible ways. And I want to also say right here that it's, for us in the US, it's really valuable to bring data at the county level as we focus on rural communities are another example of where there's limited data on understanding the impacts not only of COVID, but of health, of education at the rural level. And we generally classify and define rural at the county level, but often data is not released at that level. And so we're kind of constantly working a little bit in the dark, being forced into making assumptions or workarounds to start to understand what the experiences of rural people with disabilities are when the data is simply not available. So we've been working and advocating to get that data more available and advocating at federal levels to increase access to rural data. So the first product that I want to highlight is our disability map series. And something I didn't mention earlier was that my background is in geography. So although I became a data nerd at the RTC Rural, I have always loved maps and thinking about human interactions in space and in their environment. And so it was really exciting to work with colleagues at the RTC in order to develop this disability map series. And really this right now, we have a wide range of data, and there's a link. I don't know, let me see, is the link, I don't know if the link will be in here. Yeah, okay, so great. There's a link in the chat here, which will take you to the page to access some of these maps. But we've taken data from the American Community Survey, which is a large publicly available data set, but is also somewhat challenging and inaccessible to pull the data and identify what it is specifically you're looking for, particularly if you're interested in disability data. And so these data, we created this huge map series where we use these 2013 to 2017 American Community Survey estimates and have mapped at the state and county level a wide range of variables, so including disability status by gender, type, employment, poverty, veterans. And then we've created maps for every state in the United States across all of these variables. So I think it's something like over 500 maps, and we've made them high quality images with text descriptions for folks to access, use, and download in any of the work that they may be interested in. So I highly encourage you. There's a screenshot on this slide of that web page that shows kind of what it looks like with a little zoom in of counties in the U.S. In purple. And I really, really encourage folks to check it out. We will hopefully be updating it. It's a challenging thing to do. But the data has not shifted too dramatically just yet, and I will be showing you some examples on these next slides here of what these maps look like. So here is a map of people with disabilities in poverty using that data. So this is an example of what you can access and download from the website. And this shows a map of counties in the United States, including Alaska, Hawaii, and Puerto Rico. And disability, percentage of people with disabilities in poverty are illustrated in shades of red, and you see concentrations of red counties across the United States where we have areas that show up persistently as communities with high rates of disability as well as high rates of poverty. And often these areas are also located in quite rural communities. So what you see is kind of persistent poverty amongst people with disabilities in rural communities. And here's some more description of those. All right, and then this next slide here is showing two maps, one for South Carolina and one for Iowa. And again, like I mentioned, we have these for all 50 states and Puerto Rico. And what we see here are the map for South Carolina shows rates of veterans living with disability across each county in the state. And then next to that, we have a map of Iowa. We have the rates of employed people living with disability in each county in the state of Iowa. So that's an important thing to mention too, those employment maps. We have maps looking at people who are currently employed with people with disabilities who are employed, unemployed, and also not participating in the labor force. And that is another area in which you see a vast geographic variation across the United States, with some places having much higher rates of employment for people with disabilities and other places having much lower rates of employment. We have also done some mapping, kind of in time or timely, I guess, mapping of disasters and hoping to inform national emergency preparation and response. So the two maps on the slide seen on the screen here are of states that were in the path of, I believe this is Hurricane Laura. Yeah, so in 2020, we mapped the count of the estimated count of the number of people with disabilities, as well as the percentage of people with disabilities of their total population by county that were living in the path of Hurricane Laura. And it's important to note, like I think while you're looking at this, what you see is that on the map on the left that has the estimated numbers that people are concentrated, you see the highest number of people with disabilities living in areas that are more urban. So which makes sense. More people live there, therefore more people with disabilities live there. However, the map on the right also shows that for some communities, people with disabilities make up a disproportionate or a higher percentage of the population, and that can be a really valuable tool, and that's incredibly important knowledge for emergency planners and public health officials, particularly over COVID, to really understand the populations and understand that in some of these more rural communities you have more people with disabilities, and that is an incredibly important population to take into account when planning for emergencies and taking into account things like transportation access and shelter accessibility. So we really hope we've been able to do maps like this for Hurricane Laura. We did some for Hurricane Florence, was that? We have them also on our website, and we've done a few, and hope, or well, we hope to keep doing it. Unfortunately, we realize that hurricanes are continually getting worse and more frequent, and I think we're gearing up for potentially another big year, and that this is going to become even more important as we see an increase in natural disasters, that the value, the importance of emergency preparation and response for the disability community is huge, and that inclusion and representation in the data matters now more than ever. All right, so in addition to our mapping, our map project and some of these timely responses to natural disasters, we've also developed a tool. This is called Disability Counts Data Lookup. And we've used this creating, again, ACS, the American Community Survey estimates on disability rates. And all of the variables that I mentioned earlier that we have maps for are also available in this tool. And we've recently updated this data with the most recent data, and the chat now says 2016 or 2015 to 2019, but we've updated actually now for the 2016-2020 data. So it is the most current data. And then, as I mentioned, the variables that are included there are also available in there with the addition of race, and then also metropolitan status of counties. So what this lookup tool lets you do is, if you go, and here we have the link to the tool also in the chat, it allows you to select the state and the counties that you're interested in, and you can select all states and all counties if you want, and you can select multiple states to do state and county comparisons, and then you're able to choose the variables that you're interested in, and it will build a data set for you and provide you a file that you can download with access to the data. And this, we created this because the disability data in the tools that the census provides were formerly, in a former tool, were inaccessible to screen readers. So if you used a screen reader, you couldn't get the data. And so we made a tool that was accessible. And in addition, parsing out the data is quite complicated. You need to have quite a level of understanding and expertise in the data in order to understand and actually download data that may be usable for you. So we wanted to simplify that and bring all this disability data together into one place, specifically at the county level, so that that data was available also for the rural counties and communities where people live. And then it says coming soon, and I was tempted to put the link, but it's just not quite there yet. But I think visit our website, sign up for our newsletter, email me, and I will, as soon as this tool is available, would love to get it out to everyone. But we have also been in the process of developing some disability data dashboards as a complement to the disability data lookup tool, where we'll create, so there are two screenshots on this screen. One is of the landing page where we highlight the different dashboards that are available, as well as the lookup tool and some resources. And then 2 interactive dashboards. The screen on the right, the image on the right is a screenshot of our disability data dashboard that has all of that disability data that I've been mentioning available in an interactive map in which you can click on states and counties and select states and counties to visualize the data yourself. And I think what's the most exciting about these dashboards is that we have integrated a dashboard on institutional populations. And so this is getting one step closer to understanding where people are living in institutions. So again, these are some of those congregate settings. For this dashboard, it only includes correctional facilities and nursing homes. But it starts to break down where people are, what communities are there maybe disproportionate people living in those facilities, and in what states maybe or places do people with disabilities make up substantial percentages of those populations. So we will have dashboards exploring that, and will again hopefully inform, particularly thinking about pandemic response, understanding where which environments, where are these high risk environments, and a congregate setting is in a pandemic is a really high risk environment for getting sick and potentially dying. And so where are these environments, and what strategies can we use to get people into safer environments so that they can mitigate the risk of infection and death? So this brings me to some of the advocacy efforts that we have been part of and are helping to support. So specifically a group called DisData, Disability Advocates Taking Action, and this group formed in the fall of 2020 in response to the countless disabled lives lost to the COVID-19 pandemic, particularly in institutions and congregate settings. And that truly our national inability to count those lives and prevent their loss exposes a long-standing issue that disabled people are missing from data design, collection, and decision making. And we're working, so we are just, DisData is a group of researchers, advocates, people with disabilities, activists who are really trying to identify what data is missing, how is that negatively impacting people's lives, and how do we push for change. This group aims to work in solidarity with all disabled people, disability-led organizations, and other groups of people who are systemically marginalized due to structural ableism and racism, and to collect the data that's needed to advocate and effect for change. Really, we seek data equity for disability justice. And we really hope to see improved disability representation across all levels of data collection. So we advocate for inclusion of people with disabilities in determining what questions are asked and how survey design is developed and implemented, and what data are used to inform policy. So through this group, we have been able to do some stuff. We've been able to support Centers for Independent Living. That's CILS. That's the acronym there on the screen, in both state and national advocacy efforts. So we were able to communicate state level disproportionate impact, the disproportionate impact that COVID was having to secure on people living in congregate settings, to secure funding streams for emergency transitions pilot programs. So these were programs that were working to quickly and safely move people out of nursing homes specifically, and into community-based settings with the community supports that they needed. We also increased community awareness of the pandemic's effect on congregate settings to support current and future advocacy efforts and to increase access to HCBS, which are home and community-based services. So services that allow individuals to live in the community rather than an institution, and housing. And we also identified major data limitations and discrepancies. Specifically, we identified major disparities between CDC, CMS, so sorry, these are acronyms but very specific to the US, Centers for Disease Control, Centers for Medicaid and Medicare Services, and then state reporting data between the estimates of cases and deaths in congregate settings, where we were seeing numbers that didn't match up across all sorts of different agencies. And really, there was a lack of consistency between how governments at different levels were defining congregate settings and providing access to that data. So in many ways, we were pretty limited in the sense that the most data we had access to was access to COVID information on cases and deaths and other things in federally supported nursing homes. There's very little data on correctional facilities. There's almost no data, at least at the federal level, on psychiatric or rehabilitation centers, where some rehabilitation centers, group homes as well, was data that we could not access, that you have disjointed data collection systems, which essentially meant that many of those deaths went unseen at the federal and at the policy level. So I'm going to show, this was a tool we were able to visualize and map cases. We also were able to do this with deaths, but the map we're looking at on the screen right now is cases and the increase in cases and increase in deaths over time at the county level based on the data that we had looking at cases reported to the federal government from nursing centers. And what we were able to show was the rapid increase in cases and deaths in these environments over time. So we worked with Aaron, who's credited in this presentation, to create these GIFs, graphic image files that I can't show you the actual video here. So I'm just going to show you the first and the last. But what we were able to do was create an image showing increasing cases week by week. And we were able to create some of these for states as well and for advocates locally who were then able to use these visual data tools to push for emergency transition and relocation, and was effective in some situations in working with like federal emergency response agencies. So this map here shows the weekly COVID deaths, and so this is over 10 weeks. The next one we'll see is 10 weeks later. So starting in July 5th, 2021, we have county shaded from white to light orange to red on a scale from 0 to 59. White or light orange cases have fewer cases, and red counties have more. And I think this says deaths in the chat, but I apologize. This is a map of cases. And then this next slide will show the week of September 19th. Do I have my teleprompter? So what we see is that over time, and although we're not seeing it, clusters of county grow progressively darker. And then in this week of September 13th, shows that much more of the country is red, and that in just that short period of time that this is what increased cases were looking like in congregate settings. So I'm going back to the July, and I'm going to flip forward to September. So here I have some data. I think this shows that over the course of those 10 weeks, so the map shows that it was 36. We went from 1,200 cases to 36,000. And in that SIAM-TAC period of 10 weeks, there were nearly 3,300 new deaths reported in nursing homes across the United States. And we've specifically talked about within nursing homes, that is a population that is essentially 100% disabled. And we, in our dashboards, we do hope to be able to illustrate how some of that breaks down with age and disability as well. And so that data will be available in the dashboard looking at nursing facilities. Okay, I feel like I've gone way too long, and now here's a space, but I would love, I'm putting on the screen here how to get in contact with me and how to get involved with this data if you want. And I don't know now if I have time for questions or comments because I think I went over time.
Thank you very much. As a fellow data nerd, I really, really enjoyed that. We are running over, but perhaps, Dana, if you're okay with it, maybe, I'm not sure if we have any questions. Actually, I'm not sure that we have any questions.
That's great. Perfect. Yeah. Well, people can please reach out to me and check out our stuff.
And Lillie,
okay, thank you very much.
Lillie, this is General. You can stick around and people can